are pharmacies just phenomenal sites for doing a diabetes prevention program? Well, you're already involved and effective and engaged with preventive care. And whether that's vaccinating for, flu or COVID, or if it's counseling women of childbearing age on folic acid use, if it's smoking cessation, it could be hepatitis B screenings. These are all things I worked on in my public health career with pharmacies. You are super effective at that. And the research shows that you're effective at increasing immunization rates, identifying these high-risk patients, especially patients who are not being seen in other healthcare settings. So, working within your communities, you're really identifying patients that are most at risk. You have fantastic care teams. The pharmacist and pharmacy technicians and other paraprofessionals are doing this work routinely. You're accessible, you're affordable, you're open to your community. 90% of Americans, as you know, live within 5 miles of a pharmacy. I think about my own mom. She is, talking to her pharmacist many, many more times than she is talking to her primary care doctor, and really getting the care that she needs living in a rural community in Ohio from her community pharmacist that she may not be getting from her specialist or her primary care provider. You're located in a variety of different areas, including these frontier communities where you might be the only healthcare provider, in 80 miles. There might be this critical access hospital that's an hour away and a pharmacy that's right within that community. And as you know, pharmacists are very trusted. They're among the most trusted of healthcare providers that are out there. So I worked with a lot of pharmacies. I've also worked with a lot of faith communities. So let's think about churches and mosques and temples. They are also trusted. They are also accessible. They are also embedded in their communities. They also have a ton of time with community members. But you know what? My church really does not know about my medical background. My church does not have an EHR. They do not know, like what medications I'm taking. So, there are some things that faith communities do very well. There are some things that critical access hospital might do very well. They're trusted. They collect health data. They're aware of my medical conditions. They might even be advising me to, eat healthy and be active when I go in for my annual wellness visit, or even to an emergency department visit. They might be offering that advice. But pharmacies are really the best of both worlds. Like a faith-based organization or a community-based organization, you're trusted, accessible, embedded within the community. You have some time with community members. But like those hospitals, you have health data. You're aware of these other conditions. You're advising people with prediabetes to eat healthy and be active. So you're really like the sweet spot between these community-based organizations and these healthcare providers that people may not be encountering very frequently. So you might say to yourself, wait, didn't you just tell me that not very many people are being prescribed metformin? And so am I really seeing people with prediabetes within my pharmacy? And I will say, yes, you are, because we want to think prediabetes is kind of a part of a cloud or a constellation of metabolic conditions, right? So we have prediabetes kind of existing here with overweight and obesity. We have prediabetes coexisting with high cholesterol, with high blood pressure, and with some of these other kind of comorbidities and complications that sort of travel around with this cardiometabolic cluster. So you might be seeing people in your pharmacy not because they have a script for metformin for prediabetes, but because they're experiencing overweight or obesity. We sometimes talk about kind of double prediabetes, where we have this metabolic syndrome that's going on. So we're seeing folks with overweight, obesity, with related complications to that chronic disease, and they might be coming to the pharmacy because of sleep apnea or arthritis or reflux or gallbladder disease or depression or anxiety. We might be seeing people that are coming into our pharmacy, and we probably are, with high cholesterol or high blood pressure, with heart disease, with sleep disorders, with gestational diabetes. So while prediabetes is often asymptomatic, We're not seeing people that are saying like, hey, I have prediabetes. We are seeing a bunch of individuals seeking care from the pharmacies with these related conditions. So people with prediabetes may actually be overrepresented in your pharmacy. We're talking about like 1 in 3 Americans, but when you look at like how many of 3, maybe 2 of 3 individuals within your pharmacy may have prediabetes, they might be seeking advice with some of these complications that we talked about. They might be filling prescriptions for some of these other comorbidities that kind of travel along with prediabetes. And they might be following up with you as a pharmacist because they've received kind of guidance from their primary care advisor, that, that brief guidance of like, hey, you know what, you should really lose some weight and eat a little better and get some more physical activity. And they might be trying to activate that guidance or learn about that guidance within the pharmacy.